Local broadcast of the following program is made possible by support from members of Rhode Island PBS in partnership with
the Rhode Island Foundation, partnering with passionate Rhode Islanders to lead, transform, and inspire our state. Learn more at rhodeislandfoundation.org.
Welcome to another segment of In Another Opinion, a public information program where our discussions are focused on the communities of color in the state of Rhode Island. I'm your host, Peter Wells. My guest today is Elizabeth Burke Bryant, Executive Director of Rhode Island Kids Count. Welcome, Elizabeth.
Thank you for having me, Peter.
Oh, it's our pleasure. You know, I've watched your program and you and your activities. You're always on the go. And I've always wanted to get you in so we can talk a bit and you know, let the community know a bit more about what Kids Count is all about. So what is Kids Count?
Well, Rhode Island Kids Count is a children's policy and advocacy organization that works to improve the health, education, economic well-being, and safety of Rhode Island's 210,000 children.
Wow, it's a big charge.
Yes.
How did you get to that number?
Well, we, in terms of the number of kids,
yes.
Well, we use a variety of data sources. That one happens to be from the census. And we, every year, we put all of the best available data into our annual Rhode Island Kids Count Fact Book, which presents really a portrait of Rhode Island's children. And it's used widely by policymakers, nonprofit leaders, citizens on the front lines working for children.
That was one of the questions I was going to ask, the use of the data. Can that data be used by anyone or once it's published?
Oh, absolutely. One of our major purposes is to make sure that everyone who cares about children and families in the state of Rhode Island has a ready source of data and information. And so we are now coming up on our 25th anniversary.
Congratulations.
Which is very exciting, of producing the annual Rhode Island Kids Count Fact Book and of being an organization. We'll be celebrating on April 8th at our Rhode Island Kids Count Fact Book Breakfast. And every single year we've done the same thing. We've said, what do people need to know about kids and families, and how can we put it out there in a format that's easily accessible and very relevant to so many of the issues facing children and families today.
Well, real quickly, Elizabeth, how did the Kids Count begin? How did it get its start?
Well, back in 1994, there was an opportunity by the Annie E. Casey Foundation, which is a large national foundation, to start to get Kids Count projects up and running across the country. They had been producing for a few years at that time something called the Kids Count National Data Book, which compared every state to each other on the basis of 10 different issues of child well-being. And they quickly decided, gee, all politics is local, all data should be local, and they really wanted a state-by-state counterpart. So back at that time, the Rhode Island Foundation asked me to take a look at the kind of child advocacy organizations that were out there in the hopes of having a Kids Count project at that time get going and start to really measure and count kids in Rhode Island. And so we started as a project of the Rhode Island Foundation for 2 years and then spun out as a nonprofit organization. That was in 1997. So after 2 years of getting our feet wet, we then became a nonprofit organization here in Rhode Island.
So are you funded nationally or funded locally, or how does that work?
It's a combination. We are very fortunate to have continued to receive funding for our fact book and our core work from the Rhode Island Foundation, the United Way of Rhode Island, and the Annie E. Casey Foundation. And from there, we've added additional local foundations and some national foundations as we've grown. We have a staff of 10, and that means we're able to cover the issue areas I've just mentioned very deeply. Juvenile justice and children in the care of DCYF, early childhood, which involves everything from childcare to early intervention. We have someone who focuses on poverty and education, and someone who focuses on health. So we have the expertise on our staff, which is a wonderful team of colleagues to be able to be out there really working deeply in these areas.
Well, let's talk a bit about kids in the state of Rhode Island. Are they at more risk here than any place else, or are the numbers about the same? Are we meeting a norm?
Well, Well, it's interesting from some of the comparisons to other states,
Yes.
such as the Kids Count National Data Book, we see that there are some areas where we lead the country. Health has been one of those. We've had, as a state, a very long-lasting and deep commitment to children's health, starting with children's health insurance coverage. Back when we started, there were, 25 years ago, there were at least 12% of our kids without health insurance coverage. And now, 98% of Rhode Island's children are covered by health insurance coverage. The Right Care program has been a key part of that. So on children's health, interestingly enough, on teen death and child death, we've led the country for years. And I think that kind of tracks back to having regular access to health care, because some of the safety information and wellness information can get transmitted so well in doctor checkups. There are other areas where we're not where we want to be. We have made some progress with reducing childhood poverty to the point now where we have about 19%, between 17 and 19% of our children living below the federal poverty level. That puts us in about the middle of the pack in the country, but we want to do much better on that one.
How do you address that? I mean,
well, you know, childhood poverty, it really is a measure of family income. And so the federal poverty measure, as you know from so many things that you've done in your career, is around $20,000 for a family of three. Below that, you're considered poor by virtue of the federal definition of poverty. By anyone's definition, that's too little money to raise kids on. It's just a very, very small income. And so how we do that, how we have less children in poverty, is really a function of job opportunities and educational opportunities for their parents.
Very good, very good. So when I think in terms of DCYF and the work that they do, you advocate obviously for the youngsters. Are you more of a, do you kind of watch what they do? Are you?
Oh, yes.
And how does that work? Because they've been under fire lately.
Yes, well, we are working all the time to monitor what's happening with our state in terms of children. We, in terms of DCYF, we also work in partnership to try to make things better. So we were alarmed, as all Rhode Islanders were, by the group of deaths, particularly to very young children in the care of DCYF, or that had previously been in the care of DCYF. We were glad that a law was strengthened by which the Child Advocate's Office got a broader berth in terms of more kinds of cases to look into in terms of deaths or near deaths to children. We went to many of the hearings that were presided over by Representative Pat Serpa in the House, and we've just really we've been following the topic, trying to get best practice information out there. We were glad to see that some of what they call the front door safety issues, whether or not they investigate a particular case, were strengthened in response to the terrible group of child deaths. Recently, I was listening to Dr. Piccola speak, the head of DCYF is Trista Piccola, about systems that they changed, whereby there were cases that were called information referrals that were almost put in a holding bin, that now, if there's enough of a sense that there may be something going on there, they're investigated. So our function is to pay attention to what our state agencies are doing, hold them accountable when there are things that seem not to be going in the right direction, and also try to partner with them to promote best practices.
Are cities and towns, are they connected to the Child Advocacy Office and or your office? Is there a connection there?
Oh yes, that's a great question. All of the data that we put out there, and right now there are 71 different issues in our annual fact book in terms of children's safety, education, economic well-being, and health. All of the data, as I was saying before, either comes from the census, from the American Community Survey, or it comes from our state departments. And our pledge to the community is whenever we can break down data by Rhode Island's 39 cities and towns, we do. So when people go to our website, which is rikidscount.org, and click on data and click on our fact book, which is all online, they will not only get data for Rhode Island as a state, they will get it for each of our 39 cities and towns. And then from the start, we were struck by the percentage of children who are poor who live in just 4 core cities: Providence, Pawtucket, Woonsocket, and Central Falls. So we have something called the core cities, where we compare those 4 cities to the rest of the state, because we really try to drive policymakers toward where kids are in most need. And if I may, there's another thing that we do, is that we break down any data that we can break down by race and ethnicity, because we believe it's really important to show the disparities, the racial and ethnic disparities, for virtually all of our indicators.
You know, I was thinking in terms of poverty level and jobs and opportunity. Of course, the governor right now is really trying to push the opportunity piece and employment within the state. But it seems to me that the higher paying positions, many of them, are outside of the core cities. You know, we're looking at the 95 corridor. We're looking at going up 95 toward Boston. So poverty might appear to be higher in the core city because of access to jobs, correct?
Yes. Well, I think that's true, and there are other issues as well. There's disparities in terms of educational outcomes. When you look at the latest RICAS data, the Rhode Island new standardized test, you see very wide disparities by race and ethnicity and by income. Just in the reading by the end of 3rd grade measure, and that's what I call, Peter, a gateway indicator, because up until 3rd grade, you're learning to read. Beyond 3rd grade, it's expected that you know how to read. And there are just huge disparities, and the whole state isn't where it should be. It's been a major focus of the governors and many other people to try to get that reading score up. We work in partnership with the United Way of Rhode Island on something called Rhode Island Reads, which is really trying to get to the goal of at least 75% of our 3rd graders reading proficiently by the end of 3rd grade. So when we look at that for the state as a whole, you know, we're seeing that only about 40% of all of Rhode Island's 4th graders are reading at grade level. But then when you look by race and ethnicity, there are sometimes 25-point gaps, and that's completely unacceptable in 2019 or any year to have that kind of disparity by race and ethnicity, and also by low-income kids compared to higher-income kids.
Do you think, Elizabeth, we have, of course, Rhode Island is rich with new immigrants, new arrivals coming into the state. Does that really have a major impact on those numbers?
Well, I think it's, those disparities that we see, not just in reading, but in all of the education indicators that we track, those are not new. So those go back to the beginning of when we started Kids Count 25 years ago. And I think what we're seeing now, hopefully, is a sense of urgency that we need to turn those numbers around. We have just a wonderfully diverse community, which is richer for its diversity.
Especially in those core cities.
Yes, and our immigrant population is contributing to our economy, and there are parents of immigrant children that know that education is so important to their family success and their children's success. So I would say that the immigrant population in Rhode Island is adding to our diversity. There are issues that we need to pay even greater attention to, such as English learners. In our core cities, we have large numbers of English language learners that need high quality instruction. And there was a step forward in increasing the allocation of state dollars for English language learners. The governor has now proposed to take it from $2.5 to $5 million, but we know that's still not enough to meet the needs of English learners who want to be able to have effective instruction so that they can then be in regular classrooms and doing their best to move forward. So that's something else we're taking a hard look at.
Now, Elizabeth, you mentioned some of your partners. I know you mentioned United Way and, of course, Rhode Island Foundation. What other partners do you have that work with Kids Count?
Well, what we try to do is we say we don't have all the answers. We have great respect for organizations that are out there that are working every single day to help children. So first, in terms of the issue of the diversity of our children, I think before the program started taping, I showed you a very striking diagram that showed that 90% of our elderly population in Rhode Island, 65 years of age and older, is white, non-Hispanic. 55% of our youngest children are white, non-Hispanic. And so you see that there is just a growing diversity, and very soon our quote-unquote minority children will be our majority children. And so what we do is we try to partner with the NAACP, with the Latino Policy Institute, with groups that are working with the Southeast Asian community, in order to be sure that we are reaching out in a way to make sure that we're both asking the right questions and getting the data out there to folks who are working very, very much throughout our communities of color. And the other thing that we do is we know that there are many organizations on the direct lines, whether it's Family Service or Children's Friend and Service. All of these organizations, Tides Family Services with Brother Michael and Ms. Bixby, who just took over as the executive director, they are working daily with kids that are in need, and we try to hear what they have to say about what some of the latest issues are.
Well, your scope is very large. I mean, and of course the data is very, very important. Today, there's no dollars coming from cities, states, federal government, or anywhere that doesn't work with numbers. And so that's extremely important. I know that within the minority community or the community of color in Rhode Island, a lot of the organizations don't have the resources to do what you do in terms of developing the data to make cases for funding and resources. So it's an invaluable part that you play.
Well, and that was really by design, because we figured, and some of our partners figured out, that it didn't make sense to have a number of organizations all cranking the same numbers. It's very labor intensive. I salute our great staff team who right now are hard at work day and night cranking the numbers for the next fact book. I salute all of our data partners from the state agencies and the Census Bureau that give us the numbers that we need. So fortunately, it's really become the go-to source for children and families data, and that's what we had hoped for, because it doesn't make sense to have too many numbers flying out there. And we said from the start, our data has to be absolutely reliable and absolutely regularly produced so that people can go for it. But then it's not just the numbers. So when we started our organization, it was really about a triangle of great data, communications, and policy. So we're very strategic, Peter, in what we select to measure, because we want to be sure that we're selecting indicators that if you can move the numbers, you actually have an opportunity to make sure policy is going in the right direction, and that our issues are issues that I say you can talk about with your grandmother. They're not policy wonk type language. So we really try to put the information into the hands of policymakers in the public in a very accessible way.
You know, you mentioned the data in the Census Bureau. I know the Census Bureau plays a major role in the collection of a lot of data, especially data related to families and individuals. What are your thoughts in terms of the current census that's coming up and some of the issues with the questions?
Well, fortunately, we have seen the governor start Rhode Island's Complete Count Committee. It's a very diverse, large group of great people who are working together on the desire to have a complete count for the Rhode Island census, for the census in Rhode Island in 2020. I am very involved on behalf of Rhode Island Kids Count with the Hard to Count subcommittee, because from years of looking at what numbers have come up short, we know that young children under age 5, particularly poor children, children of color, and immigrant children, are the most likely to be missed. And so we are trying to work with our partners, with some other national partners, to say, how can we be sure that our young children in Rhode Island, every single one of them, are counted? Another very quote unquote hard to count, or have a group that has missed out, are Black males from 16 to 24. And that's another group that requires additional outreach and attention because the numbers don't lie. You can see where the census has undercounted in the past, and we don't want it to happen in the future.
What do you think drives that 16 to 24 bracket miscount on black males?
Well, I think it's a variety of different places that young black males are moving to, relocating, whether it's because of education and jobs. You would say, well, that happens to people of all races, but it has been just historically an undercounted population that we need to get right. So we are concerned about the question about immigration status. The Supreme Court will be ruling on that. We are very concerned that it already is having a chilling effect on our immigrant families. This is supposed to be a complete count of people in the United States. That question has not been on the census since 1950. It doesn't belong there. And I'm hoping that, that ruling goes in the direction of not having that question. But everyone who's working on the census is trying to get the word out about how important it is for us to have a complete count, both for, as you know so well, it drives federal dollars. How many people you have determines things like housing through HUD, as well as the number of members of Congress that we have.
Which is extremely important as well.
Yes.
You know, in the 2010 census, I had the opportunity to work for, at the time, the governor's office. I was actually chairing the census that year. And yes, the issues that people have, especially new arrivals, with how they identify themselves, you know, some people coming from Spanish-speaking countries and see Hispanic and they say, what is that? What does that mean? I'm not Hispanic, I'm Latin. You know, even and Africans would come and say, well, we're African, we're not necessarily black Americans, but we're African Americans, and how do you make the switch over? It's very difficult for new people coming in, and that is very important for the count.
Yes.
Because when we're talking about number of people living in the state, not necessarily citizens, but number of people that are living in the state, which drives so much in terms of our data. Hopefully the Supreme Court rules affirmatively in the case that that information doesn't belong on the census sheet.
Yes.
So who is running the census this year? Do you know?
Well, there is,
besides the commission.
Well, there is the committee, and I think that there's a budget item in the governor's proposed budget for some dollars to be allocated toward the census. So right now, I know that the Complete Count Committee is co-chaired by Mayor Diosa from Central Falls and Dr. Nicole Alexander Scott, the director of the health department. So we're in good hands with their leadership.
Absolutely.
And of course, you know, there's just so much at stake, as you said.
Oh, it is true. So you mentioned that you're having your 25th anniversary celebration breakfast at the Crowne Plaza, and that's on April 8th, I believe you said. Looking forward to attending that.
Great.
What would that program consist of? You know yet? Have you put that together?
Yes, well, every year what we do is we present the first fact book to the governor, and she will be there to receive it, as governors have been for 25 years, which is very exciting. And also the congressional delegation will be there, all of our Senator Reed, Senator Whitehouse, Representative Langevin, and Cicilline. We will also have leadership from the General Assembly, and we also present the fact book to community leaders, because what we try to say, it's not all about, the government plays a key role. It's not all about government. It's about public-private partnerships. So we will be saluting our fact book partners. We will have 2 keynote speakers.
Very good.
As we always do, we have a youth speaker who is going to be a wonderful young man named Pedro Moya. And I guess we should say our adult keynote speaker is going to be Mark Shriver from Save the Children, which is a national partner of ours. And we're going to have also a community member presented with the fact book, and it's going to be a great program. It's 8 to 10 a.m., and if people are interested, they can go to our website to get linked up. We do so much more than the data. One of the things that we also do is we look each year to the General Assembly and see the different bills affecting children and families or budget items. And we go up and testify because we can bring the real numbers up to those hearings. So just recently I testified at the House Finance Committee on a number of things. I testified in favor of the governor's proposal on universal pre-kindergarten, the pre-K program, because we know that what happens before kindergarten entry makes such a difference to our children. The whole birth to 5 age before kindergarten starts. And so we are excited about that proposal to add seats to our very, very high quality pre-K program in Rhode Island. I was also there to testify in favor of investments in our child care program and also school breakfast. That was another issue. It was a power-packed agenda on one
important.
night. Because how children are performing in school, we don't want them sitting there without the opportunity to have a nutritious meal. So that's another thing. We're also very focused on older kids to make sure that our young people who are in middle and high schools have access to high quality after school and summer learning programs. And finally, we're really looking toward that. Are we connecting kids to college and careers? And so some of the proposals that are up on Rhode Island Promise, the scholarship program and others are very, very important, as well as staying the course on healthcare. So it sounds like a lot, and it means we're very busy.
It is a lot.
We're very busy on all of these issues.
And people in Rhode Island have to be thankful that you and your organization is doing what you're doing, because it all needs to be done, and it needs to be done systematically and strategically, as you suggested. And it seems like you have that from cradle to adulthood.
Yes.
It's fantastic. Elizabeth, I'll tell you, I'm impressed with Kids Count, always have been, and I look forward to the program at the Crowne Plaza. I will be there, and we'll get that information and get it out to the community.
Great. Well, thank you, Peter.
Thank you. We've run out of time, but I want to thank today's guest, Elizabeth Burke-Bryant, and you, the viewers, for tuning in to another segment of In Another Opinion. A special thanks to Rhode Island PBS for making this program possible. I'm your host, Peter Wells. Follow us on Facebook and Twitter at #IAOpinion. Thanks for joining us, and give us your opinion. Have a great day.
The Rhode Island Foundation, partnering with passionate Rhode Islanders to lead, transform, and inspire our state. Learn more at rhodeislandfoundation.org.